A little bit of music.
Are you ready?
So remember, rule number one, get my bounce going, I'm looking cool, get my head going. We're gonna try the moves. Here we go. What's the exits? We go. Exits, 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 exits. Let's try exits, mouthfuls, exits, mouthfuls. Left side, pass those dishes. Oh, have some butter. Left side, maybe roll. Here we go. Yeah? Let's do the long one. We go. Start it, roll that long. Left side, start it, roll that long. Spring around. 1, 2, 3, 4. Hit. Left side. 1, 2, 3, 4. Hit. Flight attendant. Exits, masks, seatbelts. Once again, exits, masks.
Tragedies like these can be prevented by listening to your body and identifying some of the telltale signs of hip dysplasia. Hip dysplasia is a congenital or developmental deformation or misalignment of the hip joint. Some signs of the disorder include hip pain deep in front of the groin, which is the most common, but pain in the side or in the back is also frequent with hip dysplasia. Another sign frequently associated with hip dysplasia would be a mild or severe limp. The exact cause of hip dysplasia is unknown, but the disorder is widely believed to be developmental. Dysplasia is known to develop around the time of birth, after birth, or even childhood, which is why it's often referred to as developmental dysplasia of the hip, or DDH. Genetics play a role, but it's not a direct cause.
An X-ray is the easiest way to identify hip dysplasia and how severe it is. This helps with determining whether or not surgery is needed. An MRI can also diagnose hip dysplasia and reveal damage to the cartilage and labrum. Treatment for infants includes surgeries that manipulate the femur or the acetabulum to reform the joint. Surgeries such as the pelvic and femoral osteotomy change the shape of the corresponding bone to allow for the bones to connect. There are also non-surgical treatment methods such as the Pavlik harness, which gently position an infant's hips in a proper position.
Surgery can be used to correct the shape of the acetabulum so the femoral head fits correctly into the joint. Osteotomies may be performed on the acetabular side of the joint or on the femoral side of the joint. Surgeries on the hip socket side are called acetabular osteotomies or pelvic osteotomies. The periacetabular osteotomy is the most common type for young adults. Patients may also opt for a total hip replacement. Alternative treatments for hip dysplasia include yoga, anti-inflammatories, or acupuncture.